Hello everybody, Dr. Connors, section 5 of beating chronic Lyme. I don't want to try to keep these videos a little shorter. I know there's a lot of information, so and you got to read the book too. So understand your download of this whole book and this whole program actually contains a lot more than what is actually in that printed book. So if you purchase the book on Amazon, just beware, I've added a lot of information to your download pieces. So there's just the more information I know, I try to add it. So we're a practice. We're constantly updating. We're constantly improving. That's just us. So please be aware of that. Understanding barriers. We talked about this last week, that last section. The blood-brain barrier is so important, and breakdown of that barrier causes all sorts of things, but the main thing that causes is brain inflammation. I love this comic. What doctors are really thinking? It's chronic fatigue syndrome, meaning I have no freaking idea what you got. Well, that's unfortunately most doctors' situation, and we just don't always want to admit that. There's always a reason why. I mean, that is our motto. There's always a reason why. Figure out why. You don't just have arthritis. There's a reason why you have arthritis. Could it be Lyme? Yes, it could be. Find a doctor that can figure that out. Could it be heavy metal toxicity? Yeah, it could be. Maybe it isn't Lyme. It's something else. There's all sorts of possible reasons. You got to figure that out. That's a really important thing. So when you have this activated microglial cell system in the brain, you have an upregulation of what's called your Th17 response. And possibly it gets worse if you have an upregulated Th1 response in the brain. It's very destructive. It's a form, you get a lot of symptoms of ADD, ADHD. There's many forms of ADHD that we list in our brain book and how we treat brain issues. Person can have a lot of anxiety, can be in a hypersympathetic state, that's very common, and can be what's called limbic. So they're in this limbic state. They have an inability of the frontal lobe to downregulate some deeper brain centers. So your frontal lobe's purpose is really to be the executive of the brain. It gives you your reasoning power. It fires impulses to other brain centers, and most of those impulses basically turn off other brain centers. So they are, think of your frontal lobe as the parent of the brain, and the deeper brain centers as the naughty teenager. So when your parent can't parent the naughty teenagers, when it's turned off, then we have a problem, and then you start acting out in a very limbic manner. So we see that very common with Lyme disease. Symptoms with Lyme disease, anything from meningitis type symptoms, that's acute inflammation of the brain, to painful radiculitis, that means shooting pain in different parts, inflammation of nerves. I'm not going to read all these. You can look at those. They're listed in the book. I had a patient contact me a few weeks ago saying that he had every symptom that I had listed in the book, every single symptom. We hear that a lot. It's just a very, very debilitating disorder. You know when you got that kind of symptoms, you're already in phase 3. Most people that contact us are in phase 3 because otherwise they wouldn't be contacting us. So remember those phases, and we're going to be digging into those more on our next presentation. So again, if you have any questions, feel free to contact us, and I'll see you at the next section.